Ronell Nolan, President, CEO, Health Agents for America, coming to you live this Monday. The federal agencies in Washington continue to create more rules and regulations that negatively impact our industry, whether it's ACA, FFM, or Medicare. I wanted to thank the CMS staff and the HAFA agents that joined us on Friday for some Q&A about these new rules regarding fraud. And there's a couple of things that I wanted to share that maybe I was not clear about, not sure that you're clear about. The first thing is you will not be able to cancel a policy without making a three-way call, creating a healthcare.gov account, your client creating, or possibly doing it through an EDE. Now, the fraudulent agents will not be able to cancel policies anymore, negatively affecting a consumer. However, even if it's your current client, been your client for 50 years, you're not going, well, yeah, it could be 50 years. You're not going to be able to cancel that policy if they got employer coverage, they're Medicare eligible, they're Medicaid eligible without doing one of those three things. The second is if you obtain a client that has never had an agent, doesn't have an NPN attached to it, you will still have to make the three-way call, have your client create the healthcare.gov account, or do it through an EDE. And we're learning a lot of what Health Sherpa has just created. And I hear a lot of people that say they're having a lot of success. I'm hearing a lot of people say they're having not a lot of success doing marketplace three-way call. And then the third thing is if you obtain a client that has had another agent and they'd like to use you, you're going to have to do one of the three things. Call the marketplace with a three-way call, have your client create a healthcare.gov account, or use an EDE. Again, Health Sherpa has created a pathway that a lot of folks say is working. There's one issue that I still would like some clarification, and that is those that do not have direct contracts, agents that do not have direct contracts with insurance companies. Many companies throughout the nation, insurance companies, do not offer contracts, which in essence makes Medicare and ACA agents work under an FMO or GA. I have been told directly that if you do not have a direct contract, you cannot sell through the FFM. I'm questioning that, and I'm going to continue to question that because that is extremely unfair and can't be correct. One comment was made that Department of Insurance will require that. Well, I can only speak to Louisiana because that's where I live, and I know that that's not true. So if you have any feedback of whether your state requires an agent to have direct contracts, I'd really like to know because I think that's a really important point for us to help figure this out. But that's something that I'm getting a lot of questions from GAs, FMOs, and just know that I'm on it and I'm trying to figure it out. The other thing is I wanted to say is that HAFA would like to thank Senator Wyden, who recently released legislation that will create criminal charges for those fraudulent entities. Very important. They have their finger on the pulse. They are paying attention. I met with them through Zoom. We absolutely had synergy. I'm excited about working with Senator Wyden's office. I will be meeting with them in DC during our VIP Capitol Hill visits. But they were very open, definitely talked about good agents, definitely talked about the fact they didn't want to hurt us. They just wanted to stop the fraudulent activities. So very, very excited about that. Mississippi. I am still watching the news, trying to find out from Mississippi Department of Insurance if they have any indication from the governor whether or not he's going to sign a letter of intent to create a state exchange. That letter of intent is an important part and step that should have been done before legislation was passed. So still watching that. I understand Georgia is going to be approved, so be watching that, be involved. Let me know if you hear anything. I was told probably August you'll hear the actual confirmation. The HAFA Agent Summit, Washington, D.C., it's going to be here before you know it. If you've registered, you should have received an email on Friday going over all the activities for Wednesday, Thursday, Friday. So make sure that if you need to RSVP for something, you go ahead and give me that RSVP. Have to have numbers to the Willard by the 1st. So things are moving. If you're a VIP, you'll be getting a separate email telling you exactly where to be, when to be, and also setting up those Capitol Hill tours. So I've got to have exact numbers. You can't just show up for those things. So if you're going to come and you've paid for a guest, I need to know that so we can make sure that you're included. And then if you see something, say something. It's something that Dean Mose from CMS says all the time. And while I'm saying that, number one, if you see anything, fraudulent activities, something going on in Medicare, Medicaid, employer market, anything you see, you need to say something. Let me know. But what I've been hearing a lot, heard it forever, but it's ramping up again now, is things being said on the marketplace calls. If something is said to you or your client, they try to sell your client dental, which I've heard. They talk derogatively about you as an agent. You need to report it. We talked about this on our call Friday. You need the time, the date, the state, and let's report it. All those calls are recorded. They can pull those calls and they can reprimand those that are acting incorrectly. We need to know that. A couple of things I want to share real quick. CMS announced an additional $500 million in funding opportunity to increase ACA outreach and enrollment efforts. Again, we were responsible for over 80%, and if they would stop putting all the new rules and regs on us and making our lives harder, then possibly, maybe we could share in some of that $500 million. HHS authorizes 5 states to provide historic healthcare coverage for people transitioning out of incarceration: Illinois, Kentucky, Oregon, Utah, Vermont. So that's something that's very interesting, and I know that some of you are involved in that market. HHS finalizes policies to increase access to coverage for DACA recipients. Important information. And this went to the assisters, navigators. CMS recently announced that the unwinding SEP, that they may be available to more consumers. So it gave some information to navigators on how they could help consumers. I'm not sure we got that, but definitely navigators did. And then Health Sherpa is having their Member Defense Network webinar on July 31st. So please, please, please pay attention to that. You definitely want to be involved. I'm almost to the 10-minute mark, and I try not to go over, so I might just hold this information to next week. I'm so excited that tomorrow I'm going to be in Washington, D.C., putting up our artwork at the D.C. office, 1010 Wisconsin Northwest, Suite 530. Can't be more excited. Having lunch with the Speaker of the House's Chief of Staff, and then having a cocktail hour with Congressman Crenshaw from Tennessee and Congressman Smith from Missouri, the chairman of House Ways and Means. So very busy day tomorrow. I'm flying up and flying back the same day. Very important that I come back. So much work to do. with the summit. One day HAFA's going to have a full staff, and I'm not going to be working 7 days a week, so many hours trying to get this done by myself. But I am so excited to see you guys in a couple of weeks. Please let me know if I can help in any way. Much love to you. And I am proud and honored to represent the HAFA Freedom Fighters, the cream of the crop, the best, the ninja warriors that fight for your clients 24/7. Have a great day.